Good morning, how are you?
Good, and how are you?
Good. The gas doesn't look good. Where's the gas? Ah, there. Oh, gosh. Get ready to tube her. Your lungs are not doing well at all, okay? So we're gonna put you on the ventilator and make you sleep. Do you believe in God? Okay? This is one of those moments for you. So if you want to say a prayer, you can say a prayer. We're here with you. We will fight for you, but I need you to fight. All right?
Travel restrictions are now being considered worldwide after 98 people from 18 countries have tested positive for a new virus strain. The World Health Organization has declared a public health emergency after the outbreak of a coronavirus-related pneumonia in Wuhan, China.
There was a very clear first warning bell. In 2002, when the first SARS epidemic occurred in China and Hong Kong, we saw a coronavirus that went through civets and entered into humans, causing this kind of respiratory distress. But we got a second warning bell when MERS happened, because now a bat coronavirus goes through camels within a matter of 10 years, right? Now we're talking 2012. And then 8 years later, in 2020, you have another coronavirus.
With nearly 3,000 confirmed cases across the world, today, the 5th of March 2020, marks the first positive case of COVID-19 in South Africa. A tracer team has been deployed to track the known contacts of the patient.
Respiratory route, highly infectious, spread while asymptomatic, kills patients.
Disaster time is not the time for us to...
Disaster time is where normality, protocol changes. Policies get made during war. That's how life is.
As COVID-19 spread across the world from January 2020, Africa anxiously awaited its first wave. This story reveals the indomitable spirit of the staff and patients of one hospital in the capital city of South Africa. This hospital fought through the First and the Second World Wars and survived the Spanish flu. It now had another battle to fight.
I think it's a deleterious event. I think nobody prepares us for such a crisis.
We're building our ship during the storm, which is not something we're used to. We like to have facts, we like to have literature, we like to have good information to guide us.
We are so used to handling the sickest of the sick. In that sense, we are prepared. But nobody prepares you for a pandemic which is going to hit and change the way we do normal things.
And we're sort of going along with a lot of uncertainty.
I think that's probably the most difficult part of it, that you don't know how it will unfold.
But somewhere there is a light at the end of this tunnel. There has to be, we have to believe it. So let's wait for that. Let's hope for the dawn to break. So good morning. This is patient 0, Violet Matoma, and she's the first patient that we've admitted with the COVID infection. I was terrified, actually. All the nurses were terrified as well.
Fear. I think fear was the predominant thing for all of us.
The potential that somebody might lose the battle against the pandemic is my biggest fear.
We'll wait a little bit until we can do the scans, okay? I want you to be a little bit less infectious before we take you out, okay? That's good. She came in with an acute exacerbation of asthma, and she hadn't been taking her treatment. I thought the worst. Okay, so we'll stop the augmentation, and then we'll see. I thank God we didn't have to intubate her that day. But I remember running away, going to the bathroom and saying a prayer.
I think any frontline worker that you speak to had that first encounter where they hyperventilated and they didn't know if they were going to get through it, and they probably scrubbed 3 times too many afterwards. And then we developed into a rhythm, and we started finding our systems and trusting our systems, which was great.
He's more conscious, eh? How's the swelling on his legs?
Better.
It's better, okay. Albumin is up, okay, electrolytes are good. He's not dehydrated anymore. The renal failure is actually gone. We're okay. All right, well done. I was born in Malawi. I'm the last born in a family of 5. My parents really believed strongly in education. My dad was a civil engineer and my mom was an accountant. And they ended up here in South Africa. And it was during that apartheid era. So it was very, very different from the way I grew up in Malawi, where it was so free and there was no segregation. I did my whole primary school as well as my high school at St. Mary's in Johannesburg. Then I went to university in Tux. I did my Bachelor of Science there, and then I did MBCHB, and then I specialized also at the University of Pretoria. So probably surgery, Mane. And then other than that, continue with your feeds for now. Continue with your antibiotics.
When the pandemic started, I immediately realized that this is one catastrophic event when no photographers were allowed. And being a photographer myself, and also having access to the inner sanctum of the front line, I felt obliged to document it. But what started off as a pure interest of mine soon developed into a very powerful story. And that is when I asked my friend and photographer Shem Compion to join me.
And once we delved into what it was, I was in. I realized, hey, this is something that is so unique within the context of our lifetimes. And it has to be documented. It has to be recorded for the legacy that it is going to be.
Ken jy nog jou woorde, Ben, om met doos te kan praat? What happened? Are you okay? Are you okay? Do you have allergies?
Can I
Contact your family or friends? Friend.
Now to our main story of the day. President Cyril Ramaphosa last night declared the pandemic a national disaster.
Fellow South Africans, the world is facing a medical emergency far graver than what we have experienced in over a century. The World Health Organization has declared the coronavirus outbreak as a global pandemic. There are now more than 162,000 people who have tested positive for the coronavirus across the globe. Given the scale and the speed at which the virus is spreading, it is now clear that no country is immune from the disease or will be spared its severe impact. We have now declared a national state of disaster in terms of the Disaster Management Act. Following an extensive analysis of the progression of the disease worldwide, we are imposing a travel ban on foreign nationals from high-risk countries as from 18th March 2020.
The community infections will start now, and we're starting to see it. So from today, there was around about 116 people infected, and we are out of the area. It's only people who traveled. Perhaps in 10 days' time from now, we will talk something else.
The Prof. Anton Stolz was the head of infectious diseases when the pandemic started, and the whole COVID preparedness project really was his brainchild. Unfortunately, Anton passed away in May, just before we really started getting going with the pandemic, but certainly he left us with an incredible legacy and an incredible preparedness to follow. And after he passed away, I then stepped into the role of the COVID response for Tshwane and Stipika Academic Hospital and the University of Pretoria.
This is a young girl. She's 14 years old, and she came in yesterday. She looked fairly well, but she was blue, completely blue. She had very little chest indrawing and very little signs of distress, the typical happy hypoxic.
Ons het agtergekom maar asemhaling is baie vlak. Maar ons het maar gedink dit is deel van die koors.
And she was completely conscious and aware and awake.
She actually gave us a full history of exactly what was going on, how she was feeling.
But her blood gas was complete respiratory failure.
Let's put you on the bed quickly. That's right. And she was sitting in the typical tripod position on the bed. And as soon as she was sitting in that position, we knew that there was trouble.
With a peripheral saturation of 28.
I've never seen someone with a saturation that low and still talking to me.
Ons het buite op die parkeerarea gestaan.
En hoe meer almal gehardloop het, die dokters gestop, het ek besef iets is nie reg nie.
At one stage I counted 14 people around Tarina's bed, from emergency department doctors to Dr. Nyasulu. ICU nurses came to help, as well as ENT, and one of the anaesthetists also came down to help us just to intubate Tarina, to put in IV lines for her, a CVP line for her, just to try and resuscitate her and get her stable at that stage.
Everybody in the hospital especially was very terrified when we saw this little girl with no comorbidities whatever, healthy child, suddenly come in and present with such severe symptoms.
Extensive bilateral lower lobe ground glass infiltrates with confluence in relation to the left lower lung zone, features consistent with extensive COVID-19 pneumonia.
Hulle het ons aanvanklik vinnig ingelaat die dag toe sy opgeneem is in ICU, so ek het besef dis sy wat daar lê. Dit was vir my 'n werklikheid. Dit is nie 'n droom nie, maar dit was so vinnig. Ek kon nie eers behoorlik inneem wat's alles in die kamer, of sy alleen is, of sy haar eie kamer het nie. Dit was baie vinnig en baie onwerklik.
After we intubated her, we ended up giving her tocilizumab, and we gave her the best of what we had available.
Ek het dadelik besef hierdie gaan nie 'n lekker tyd wees nie, maar ek het nie besef hoe siek sy is tot daarna wat die dokters met ons kon praat het nie. Ek het besef sy's op geleende tyd en elke oomblik is krities.
So we need to drop those pressures. How long did you play yesterday?
Op daai stadium was dit vir my verskriklik erg en dit het vir my gevoel ek kan nie bid nie. Dit was my net, ek was te bang om te bid op 'n manier. Ek wou nie my foon vir 'n minuut alleen los nie. Ek was so bang die hospitaal bel of daar's enigsins nuus van daar af.
I never wanted to give them any bad news. Like I really tried so hard not to speak to the parents because I didn't know what I was going to say.
Ek het ons naaste familie laat weet, my ma, my man se ma, en ek weet daar het baie mense vir ons ingetree op daai stadium.
We thank you that we can come together like this as a team of healthcare workers to face the challenges of every day and days ahead. Amen.
I realized that this story had to be told, but pain like this is almost holy territory. And I felt like I was intruding, and I couldn't get myself to film her.
The president announced that level 3 lockdown measures will remain in place. This is due to escalating numbers. He stated that the enforcement of existing regulations should be strengthened.
When we had our first case on the 5th of March, I was anticipating we would see a curve and a peak in April, just like the way it occurred in New York, just like the way it occurred in Italy. But I think because of our very early action, we pushed that back by about 8 weeks.
We realized that the emergency department was becoming too busy. Also, we were seeing too many COVID positive patients at once, making it a risk for other patients. So we decided to put up tents and to see all the quick in and out and the normal emergency department patients outside, and kept the COVID positive or the high risk patients inside, where the aircon, the airflow, the negative pressure was, just to try and keep everybody around us as safe as possible.
So we actually saw the peak in around middle of July.
We didn't know at that time we were peaking, so we were trying to anticipate even more than that, which is practically unthinkable.
And how deep after? Good girl. Again?
The greatest tragedy is the lack of normalcy or normalcy, you know? Everybody has just become so fearful of each other. You can't touch anybody, you can't hug anybody, you can't be human.
For me personally, I think the most difficult was that we had to actually learn to work the way that we're not supposed to, which means patients isolated, no family involvement.
There's a lot of loss of personal contact with our patients because we have layers of PPE between us and them.
And there's no physical touch. No one can touch your skin. We're always gloved up. And I think human touch is so healing.
Working with a mask, gloves, this full gown, it's not something we are used to.
It's more cumbersome to do surgery with PPEs. You've got more barriers in front of your eyes. So you've got the problem with water vapor and condensation on your glasses.
We're practicing in a completely different paradigm. We're practicing where families can't be next to bedsides, where patients are potentially being palliated at end of life.
A lot of people who are dying require that human touch. They require just that extra bit of love and attention and affection. And COVID has taken that away. It's taken away that intimacy that patients need, that we need, you know, to know that someone's at peace.
Al wat ek gehoor het was kritiek maar stabiel, kritiek maar stabiel. En almal wat bel jou en vra, hoe gaan dit met Tarina? En dan sê ek ook maar kritiek maar stabiel.
Everybody in the hospital is pulling for this girl and rooting for her to just get better. It's terrifying because this could be one of our children.
En die Dinsdag het hulle vir ons laat weet dit lyk asof sy haar oë wil oopmaak.
Ek het in die saal wakker geword die eerste keer, maar dit was aand. Ek onthou dit was donker en daar was 2 susters langs my. Maar ek kon glad nie beweeg nie, ek kon glad nie praat nie. Ek het nie geweet hoekom nie. En ek het begin stres, want ek kan nie eers vir hulle net bewys dat ek wakker is nie. En ek het net gesien hulle monde beweeg. Ek kon niks hoor nie.
Die eerste 2 dae het hulle maar net die foon by haar oor gehou wat ons probeer vir haar verduidelik het waar sy is. Ek kon net dink hoe te mekaar sy moet voel. En dit was baie sleg dat jy nie kan gaan kuier nie. Of net al kan jy net vir 5 minute daar wees nie. Dit was seker die slegste paar dae in my hele lewe.
Friday night when they said he was positive, we thought we just had the flu. I mean, we get the flu every year around this time. So it didn't really cross our minds that it could be COVID. It really didn't.
And then it was on the Saturday that the 3 of us, went for tests then as well. Yeah, we got the news the following day that we were all tested positive. And then on the Monday, I ended up taking my father to hospital.
Because he was coughing badly and his sats dropped dangerously low.
So while he was admitted, he deteriorated initially, went into pulmonary edema, worsening ARDS. He had like a lot of secondary infections.
The situation didn't drop when we turned him over. No.
I went a week later. My son had to just carry me outside to the car because I could barely walk.
So when we have to ventilate both couples, it becomes such a problem. Because how do you tell a family that both your mom and dad are in critical condition?
To then deal with the news, understand it, psychologically deal with that myself, and then still have family members that weren't dealing with it quite well, so still have to try and help them to deal with the news as well.
Manuel, you're doing well. You must fight, okay? You're strong. You're doing very well.
And you know, Mabel's 76, I'm 70. Yes, you think about it all the time. Are you going to be carried out in a body bag or in a wheelchair?
Especially when you're sitting with both your parents intubated on ventilators. So, and you're very limited as to what you can do because you can't go to the hospital and find out what's happening. So you're literally reliant on a phone call in the morning and then a subsequent phone call in the evening.
And I thought, I've got to live for my children and my grandchildren.
Yeah, every day you don't know if you're going to get a... We had a lot of days of good news. And then there was the one day, which actually started off very positive because they managed to get both of them awake, in which he had the heart attack in the evening. Yeah, that was probably the hardest of the lot. No, it's a daily thing, eh?
It's also the time where I think we saw everybody crack a little bit.
Having experienced what... Sorry. Sorry, I'm getting emotional. It has taken a lot for me. I know it's taken a lot from the nursing staff.
The staff is tired, but they're doing what we're expecting of them, which is actually amazing.
I think they've borne a brunt that we probably don't fully understand and certainly the public don't see.
But it's the career that we chose. I feel sorry for my colleagues. We get together every now and then when we can and we talk about the stress.
Every night when you get home, you have to be sure that you're not carrying a potentially deadly virus to your family. I mean, that is emotionally exhausting, I think.
And comparing notes between other doctors and other hospitals, it's just as bad.
I haven't seen my baby in over 2 weeks. I haven't held her or my family. And again, today I was reminded of why. Last week we had 8 COVID-related deaths, one of which was a healthy, fit 19-year-old boy. And today, his family came to get tested because they had held the child before he died.
Ek dink ek het amper vergeet dat enigiemand op enige tyd kan net gaan. Jy kan jonk of oud wees, jy kan gaan as dit jou tyd is.
There was a time when literally patients would just die and I wasn't expecting it. And for us, we haven't had that many deaths but the severity of the illness changing and people potentially being on life support and potentially dying, that in a day can just drain you.
Daar was een aand, my vel was geel, maar ek het gedink ek het soos nie bloed of iets in my lyf nie, want ek voel soos ek krimp die hele tyd, so ek het gedink daai aand gaan ek dit dalk nie maak nie, want ek het ook drome gehad, so swart drome en weird drome. En die suster het die hele tyd by my gesit en my probeer kalm hou.
Elke keer wat die foon gelei het my hart amper gaan staan. As jy sien dit is jou ma of dit is jou sussie, dan is dit al vir verligting dat jy kan sien dis nie die hospitaal wat bel nie.
En toe ek die oggend wakker word, toe het ek begin beter voel.
Seeing her do well gave us all hope.
Significant improvement of the pulmonary veiling.
Something that I've definitely learned from all of this is that to have a fighting spirit, to have that desire to live, the will to live, can really sustain a person in their time of need.
En ek het nie besef hoe vegter my kind is nie. Dit het my ook op 'n manier oopgemaak.
That was one of the single greatest victories that we all felt, because sure, that little girl touched everybody. And to say goodbye, Tarina, go home, be a normal kid.
Sy wou self uitloop en toe sy sê sy wil loop, toe besef ek nou beter ons haar by die kar kry, want as sy nou in mekaar sak, vat hulle haar terug.
Dit was actually 'n wonderwerk, ek dink.
After being discharged, Tarina still suffered from fatigue, and a physician requested an MRI scan of her heart because cardiac symptoms and effects are quite common in COVID.
We saw lots of new onset heart failure, patients presenting with myocarditis clinically, as well as patients with arrhythmias.
For me, that's one of the enigmas of this viral disease that we have to try and understand. That, we know that over 80% of the patients have mild symptoms or no symptoms. Why do the other 20% have symptoms? And why do 3-4% of the patients get so sick that they need oxygen? And we actually don't have an answer to that question.
Okay, trek met die asem in. Los uit.
14-year-old female patient with previous history of COVID-19, full stop. Cardiac MRI performed to exclude myocarditis, full stop. There is no evidence of dilated cardiomyopathy, full stop. This is a normal cardiac MRI, full stop.
For her to come out practically unscathed, it's amazing.
So today is Wednesday. 2 of my patients were extubated yesterday, and I'm very excited that families are going to be reunited with their parents and parents with their children, especially the extubated patients, having to FaceTime their families for the first time in like a couple of weeks. And it becomes very emotional, and I think it's very good for the morale in the unit. It's very good for us as well to see that our hard work is paying off
So it's not all depressing. It's actually quite fulfilling what we're doing. So today I'm looking forward to a very good, happy day, so to speak. Good morning. He's so much better than we expected, eh? No. But he's a very stubborn character, and the stubbornness in him is actually what's pushed him to do so well.
They only moved me next to him after about a week or two.
We elevated the bed a short time ago, and it was amazing. It was just absolutely amazing to see the face expressions of both of them, how they greeted each other.
Then my voice came back after 4 days. Then at least I could speak.
Mr. Kulo, hello. Your wife is doing much better. Okay. If possible, bring her here, eh? To see you. Can you hear?
They took me in a wheelchair.
There's your husband, Manuel. You've got a visitor.
Now I'm trying to tell him everything because I know he can't speak, but he can hear.
And she said something that he didn't expect her to say. He got very angry and he's like, then I said, do you want her to leave? No. They're very cute. The interaction is very cute. And just when we're thinking that things are getting better, I admitted another couple. I tubed and ventilated the husband, and this morning we had to ventilate the wife. So the emotional component of it on us, speaking to the family and the daughter, it's all over again, and it's traumatic. Hello, Gobzico. How are you?
One day the sister lifted my bed and the one in his room lifted it. We were next to one another. And he really looked so nice. I thought he's getting better. He didn't look like a very sick person. Then he phoned my son in Australia and he phoned my daughter and just said he's terribly tired, and everybody knew he was going, excepting me.
And it was devastating for her to know that her lover of 60 years had passed away and she wasn't there to see it.
How are you, my darling?
She asked me particularly, she said, do you remember his last words? And I said, poignant. He said, I love you to death. I said, no, don't tell my wife I love you to death. She'll know I'm dying. And then he said, tell her I love her.
Hey, Coco is going home. Hey, you are going home, Coco.
And then things started getting better.
The numbers are definitely reducing, but I think we shouldn't relax too much and think that things are back to normal until all of our restrictions on the lockdown have been eased.
Restrictions on the sale of alcohol will be lifted
subject to certain restrictions.
And when the first lockdown ended, I went out with these paramedics, and immediately we saw the pickup in alcohol-related accidents. These guys were going in blind.
They never know how serious this patient is. Remember, it's just a call center giving them a call.
So these guys were really at the forefront of the COVID response.
How is he doing? Is he awake? Oh, he's awake. Lift up your hand for me. Let me see a little bit. Can you lift up your hand? Good. Excellent. You're still tired, okay? But it will get stronger. You haven't had a stroke or anything like that. It's the muscle relaxants, okay? They will wear out of your system. We'll keep on doing the physio. He's had so many multiple setbacks, but every single time he fights through it. And this is now, I think, week 3 of his admission. And he is wide awake, cooperative on minimal ventilation, on ASV. He's doing so well.
I knew that Manuel's situation was very different from mine. Firstly, he had a lot of secretion. He's also got a kidney problem, and he's also diabetic.
But he did get it a little bit harder than what my mom got it.
If she's off oxygen, wifey's going home.
Oh, really?
Yes, yes.
Oh, boy. I went home on day 27, not day 19.
Extensive interstitial component now noted with the subpleural changes of secondary infection and possible early fibrosis.
Saying she had a scan yesterday.
Yes, I asked for a scan.
When initially I was trying to understand this disease, I didn't really appreciate that when we talk about COVID-19, we are talking about 2 quite distinct phases of this disease. The initial phase is the viral infection. But the virus is cleared, usually, by about 2 weeks post-infection. And that's when I've seen the next stage of this disease, which is not about the virus, but about the body's immune response to the virus. So actually, that stage of the disease is the more severe than the viral stage.
The sequelae thereof of the COVID is the problem. Now, when to let them go home, they still require high doses of oxygen. So it's a problem. You had normal lungs before, now you've got this fibrosis. It's terrible. So give her prednisone again. I'm going to tell Paul to give her an IPAP of 12 and an EPAP of 8. Make sure she mobilizes. That's her job today. So the 19th of the 8th, mobilize.
We would like to bring the wife over this morning to go visit the husband.
No, no visiting anymore. They're allowed to look at each other, end of story, no visits. She gets too anxious, then we forget about how sick she is. So no. Good morning.
Hello, Doctor. Just take that off so we can get a nice.
You want to see my face?
What a nice picture.
Later, I promise.
Okay.
I promise, okay? After the OptiFlow, then give her another BiPAP when she's proning. COVID definitely played a huge role in how we managed our patients.
In terms of the treatment of patients, if anything changed, it was really our level of confidence in knowing what we were doing.
What I've noticed with the controversy of just basic ICU management, our patients, we prone.
1, 2, 3.
The minute you're in respiratory compromise or respiratory failure, whatever varying degrees, we prone them.
1, 2, 3.
I literally think that is the one factor that actually changes patients' prognoses. I explain to the patients why they need to prone, because some patients are reluctant. So the longer you spend on your stomach, the better.
And that makes me very anxious.
I'll give you something for anxiety as well, because it's very important that you are calm during this process. We show them the gases, what they look like after you've proned and when you have not proned. And the recovery rate is so much faster.
It took a few days to be able to stand and sit on the chair, and then a couple more days and I could give a few steps. So they only let me go when I could walk around the bed.
I love it when they get reunited with their families. I think it's the most beautiful thing. And to me, that's thanks enough.
My biggest worry is, it's how do I go to recover?
Well done. Well done. Okay. So I see we've turned into the side now. He's on ASV. What's his PEEP? Okay. And what was his gas this morning? Still at 75, so no, not bad. I accept this gas. Personally, I look at the healthcare worker as having to be the person who holistically puts everything together. So I'll have to look at, yes, treating you and treating your disease, but as a human being, you are more than just your disease. You are a parent, you are a grandparent, you are a CEO.
I was telling the doctor I want to go home.
Go home. Who wants to go home?
He's a CEO in his company. He is a boss. He gives so many orders to everybody. He cannot take orders. He doesn't like it. So he is adamant he wants things done in a particular way.
Look at me. Very soon. We have to get this thing off. Very soon.
As a healthcare worker, if you look at him in a holistic, more holistic point of view, and you kind of not take away his role as a CEO, but work with him so that he can understand why he needs to do certain things the way you're asking him to do it.
We're going to give you a trial today. Okay?
They put a wheelchair about a meter away from me. I couldn't get to it. Amazing how in 44 days you lost all your muscles.
Ready? On the count of 3. 1, 2, 3.
The only thing this sickness didn't destroy was my brain.
Want to talk? I know you want to talk.
Because I could work out figures. I could run my business from there.
My God. You're absolutely amazing. I am so proud of you. I cannot tell you.
There's something about not even just the ambiance, but the personality of this hospital, where everybody kind of bands together. The porters, the cleaners, they're all part of our dynamic. There's a particular girl, Tanya. She knows exactly what we need when we need it, and she goes the extra mile every single time to sit with a difficult patient, and she will don and she will doff and just be the extra little bit of help that we need, even when we don't ask her to.
I assist all the doctors, nurses, patients with everything.
And she has such pride in what she does. And when I'm doing something wrong, she stops me and says, Dr. Nyasulu, do it right.
She understands us. We also understand her.
And that's the kind of environment where we all work, where I don't mind being told by someone who is maybe junior or in a different field of practice, telling me what to do.
If you don't do a correct thing on her patient, she will act.
Good morning. How's my superstar? Are you tired, Mr. Kwelu? No? Not at all. I'm so proud of you. He's okay, and he's gonna go home tomorrow, hopefully.
When they pushed me out, all the nurses, what was available were there, and the last person, he was the doctor.
I'll see you in 2 weeks' time for your checkup, okay? And all the best.
And she hugged me, you know. I said, thank you very much for saving my life. She says, not me.
It's definitely a group effort. It's everybody putting in what they need to do to get these patients better and back home. And it gives us hope for the future. It gives us hope that we're actually gonna beat this pandemic.
to do it? The bottle?
No, not a bottle. There, welcome home, Manuel.
I discovered that I had COVID on the 18th of September, and I was rushed to Zuid-Afrikaanse hospital I thought it was asthma or flu because I'm asthmatic. While I was there, they discovered that I have pneumonia also. The first 2 days, it was the most horrible because I was having hallucinations, I was panicking, the breathing was too severe. I was even scared to turn because when I turned, the pain from the chest was horrible. There were 2 patients next to me. I guess 2 passed away when I was there.
Hierdie siekte is 'n brutal siekte. Dit het nie ras nie. Dit het nie gender nie. Dit het nie ek is ryk, ek is arm.
I think from the 21st, I had a big bone recovery, just like that. Maybe I was meditating, I don't know, because I was panicking about my kids. They were flashing in my mind. So my third born sent me a card saying, "Mommy, please come back home, we need you. I'm a girl who's supposed to raise me when I'm not here." I said, "You know what? This is where I have to fight this COVID. My kids need me more than ever, more than anybody else."
Ek is 'n opgeleide ICU suster in cardio en cardiothorax. Ek het my opleiding gedoen om te spesialiseer in my ICU by Tikkies hier in Pretoria in. Die 18de van September toe ek begin agterkom ek is in die moeilikheid. Ek het nog steeds nie besef dat ek COVID het nie, maar ek het geweet iets is hel verkeerd met my. Ek het aanvanklik gedink my kop raas. Want hoekom het ek gesond uitgeloop na my asmabehandeling en skielik van die Dinsdag af net al sieker en sieker geword. So ek het regtig gedink ek het seker 'n mental probleem. Ek is 'n nat keis.
Beter vandag. Die suurstof hou mooi. En deur die meer het ek vanoggend vir jou gesê is nog steeds hoog, maar hy kom af. So ons hou jou op die voldosering Klexine. Ons gaan dit net 'n bietjie afbring want jou antifaktor 10A was hoog. En ons is nou by dag 8 en dit gaan beter. So dis 'n goeie teken.
No evidence of pulmonary embolism present, full stop. Patchy areas of ground glass opacification still visible in the subpleural areas mainly.
I'm your first healthcare worker that's going. Die Dinsdag, toe begin ek hy selle hoes kry. En ek bel toe vir prof sê my kom nou by die hospitaal uit.
And we don't quite yet understand why some individuals seem to overreact immunologically. Why do they go into overdrive in creating the cytokine storm that just mobilizes your entire immune system against this virus? And it's that immune response that does more harm than the original virus.
Prof, Iterman het vir my gesê, dit is wat my nou op die oomblik agterhou, is my longe.
So I've done a lot of follow-up work for staff members, in fact, and healthcare workers, and we're seeing a lot of late sequelae.
And these are likely to affect quite a number of organ systems in the body.
Cardiac, lung sequelae, the chronic fatigue.
And we cannot attribute these things to any pathological process or any pathology per se, except for the fact that you have had COVID.
And then, of course, the psychiatric side effects.
Mentally, het ek baie swaar gekry.
We've noticed patients who have a prolonged delirium and long-term cognitive impacts of this virus.
Jy kry verskriklike drome, laat iemand jou dood versmoor. Dan skrik jy wakker met hy benoude bors en jy dink gaan ek nou regtig dood.
It's quite something to go through this to have survived it, all the usual post-traumatic stress things.
Die persoon waaroor ek die meeste bekommerd was oor my seun. En ek en hy is verskriklik na aan mekaar. En daar het hy vir my geskryf, ma, lekker slaap, love you lots like jelly tots. Toe ek ingekom het weer met my pols wat so onregelmatig was, my man sê het in die huis geloop en het geroep, mami, mami, mami. En reg uit kamer toe en vir my man gevra, waar is my ma? Moenie vir my sê, jy het my ma weer hospitaal toe gevat. Gaan my ma huis toe kom? Gaan ek my ma sien? Ooit weer?
Most of us know somebody who didn't survive this. I think the long-term sequelae will certainly be there. I think what's happening now is we're seeing an uptick in numbers.
Our admissions is on the increase, there's no doubt about it.
We'd finally won the victory during the first wave, and then suddenly it was just an outpouring of the disease, and it was...
So it might have been the Dexa. What time did they give it to her? 6 o'clock in the morning, eh?
There's a sense of almost, I don't know if it's post-traumatic or pre-traumatic stress, because we know what we've been through and nobody really wants to go through that again.
Why is this happening again? We've just done this. We've just won this battle. Now here comes another war.
I think the second wave is hitting us much harder than we actually anticipated. It hit us a little bit earlier than we actually anticipated. And the patients are more sick.
And they become sicker much faster.
I think the patients complicated quite early.
And when they present, they are actually in a really bad state.
Either they did not expect to complicate as quickly, or they waited and they thought, you know what, maybe tomorrow I'll feel a bit better.
The majority of the patients that we do surgery on now is because of that. Patients that present too late. People are too scared to come to the hospital, therefore they stay at home until they cannot anymore.
I had a patient who arrived here with a saturation or oxygen level of 8%, and usually we have 99%.
I have seen so many people that are referred to as the happy hypoxics. They're actually walking around with low saturations, but are blissfully unaware of it. And it relates to the way in which the exudation occurs inside the lungs. Because the virus grows inside the alveolar sac in those cells, the body's immune response creates an exudate in those alveolar sacs, and so you can't exchange oxygen. You're not actually in respiratory distress. You can breathe. You just can't exchange the oxygen that you breathe in.
Okay, where is that coming from? Why is her HB dropping? No Malina, no still nothing.
The patients wouldn't respond as easily to the medication, to the same therapy that we'd given them.
The husband of the one that you tubed yesterday, Habi is looking terrible. He needs to be tubed as well.
Previously we had a lot of optiflows, a little bit of ventilators. Now it's completely the opposite, and this is where we are being tested a little bit.
Alida, let's find out what's going on. Morning. We have to speak to him. He's like, I hate the news so much right now.
They were so terrified from what they're hearing on the news. It adds like a greater stress on us as the healthcare worker to ventilate our patients, because now I have to convince you on what the right treatment for your management of your disease is.
He's on 95% FiO2, and he's like, wait, don't intubate me yet. And he's 44 years old.
So half the patients are terrified. They hear the word ventilator and they think I'm going to die. And you have to psychologically get into them and tell them, no, 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 you will be all right. We need to do this to buy your lungs time.
Sunday night at 3 o'clock in the morning, I went to the toilet and I just felt so weak. I had to phone my husband and say to him, there's big problems, yeah, I need to go to the hospital.
Bedine was quite sick. She was transferred from another hospital because they didn't have any beds to admit her, and the physician already phoned us to prepare for the worst. We took her up to the ICU department as soon as we could. Dr. Nyasulu, our physician who looked after her, immediately started her on Optiflow. I assisted her. We put up some IV lines, CVPs, all of those things. We stabilized her, and then we proned her just to relieve some of the pressure from the lungs so that we can just help her to breathe a little bit easier.
I run about 60 to 65 kilometers a week, so I'm fit and healthy. I thought a few days and you're going to be feeling better, but big surprise.
Oh gosh, get ready to tube her. Press my mask at my nose. Okay. Let's go. Paul's coming in, right? I'm not sterile, so it's fine. Hi, morning. Don't drink, don't drink. So, your lungs are not doing well at all, okay?
I remember saying to Bedine that we have to intubate you, and she was worried and she was scared.
So I'm gonna be here. The anesthetist is just outside, but he's gonna be here as well, all right? So now we're gonna make you sleep and put you on the ventilator and make you lie down on your tummy.
And I was just like blown away that it can take you out so quickly.
I think she didn't anticipate it going so bad so quickly, but that was the only thing that we could do to actually save her.
So let's put her oxygen on 100 in the meantime.
I was lying there and I was so scared because you literally feel like you are going to die.
Look at me, you'll be okay. All right, we will fight for you, but I need you to fight, okay? All right, let's go. Okay, let your head hang down a bit. Head hang down, go down. Do you believe in God? Okay, you open your eyes, look at me. This is one of those moments for you. Your God is here, He's looking after you. So if you want to say a prayer, you can say a prayer, we're here with you. All right?
I don't think she felt as bad as what her gases looked like. So part of the terror came from the fact that she doesn't understand why it's turning so quickly. And I think it's also she's a young mother.
Focus on your children, focus on how much you love them, and they want their mommy back.
And the fact that you can't see them and reassure them that you love them, and you feel so afraid and so insecure.
Nuh-uh, don't move. Hold her hand. Ready? There we go. Okay. Good. NG2? I'm very happy. Thank you very much. Untie me, please. Oh, thank you.
Thanks, Chase. Bye.
And I'm so grateful for the nurses that work there.
I could see that she was very stressed and she was very sick. And she was worried about a lot of things in her life.
I remember I asked her if she can just sit by me and hold my hand.
And the only thing you can give to those patients that you are looking after is prayer and hope.
She recovered incredibly quickly. Well, within the week, actually, she was already extubated. So she did very, very well. The first 2 days, we kept her prone and paralyzed, and she did very well. Her gases were looking fantastic. Even by, I think, 6 hours post-intubation, she was looking fantastic. But because she had deteriorated so quickly, I made sure that we keep her intubated and ventilated until her lungs had fully recovered. One thing I must say is when we see the patients getting better, it gives us a different kind of strength and it gives us a pull to say keep going because we can beat this. Good morning. How are you? You're looking very well. Off oxygen for the whole day. Well done. Well done.
But when the vaccines emerged, that was when there was hope again.
I was initially somewhat skeptical that we could get a vaccine, within a year. Mainly because humanity has never made a vaccine against a coronavirus successfully that's been licensed.
The fact that the vaccines are out has given us all so much hope because it's going to stop this virus from propagating. And that's the most important thing that we need.
The vaccine will help us, but it's not going to help immediately. It's going to take time.
Those of us who are fortunate enough to be vaccinated already see the light, and there's a huge difference.
One of the things that has really disappointed me at a global level in this epidemic is how I have seen this whole issue of vaccine nationalism play itself out. It's really been disappointing that rich countries want to use their buying power to make sure they have the vaccine first.
Everybody looking at how they compete to procure PPE and other supplies for their own populations.
There's just a fundamental error in their belief system, because you really can't have a situation where one country is safe while the epidemic is in the rest of the world. We're not islands here.
But on the scientific front, there have been huge global collaborations, and I'm proud to see that African countries have not only participated in these, but have led many of those scientific endeavors.
But I think in general, people are also looking for very quick answers and very quick solutions, which science hasn't been able to give to them. In fact, the more we look into COVID, the more questions we have.
The more we think we know, then the virus actually turns around and it mutates and it gives us another variant.
Fellow South Africans, it's exactly 15 months since we declared a national state of disaster in response to the coronavirus pandemic. We have never experienced a health crisis of this severity before, nor one that is so prolonged. But although we have reason to hope, we still have a mountain to climb. A third wave of infections is upon us.
When this journey started, we were all very much overtaken by fear, anxiety. We didn't actually know how we would deal with it, how much we could take, and what our limits were.
It has highlighted for me that how much we, South Africans, have been so fortunate to have been brought up under the concept of Ubuntu. That I am because you are.
I think we've found strengths in our team that we didn't know existed before.
That fundamental concept of Ubuntu is our strength against this virus.
It's only day one, so let's be careful. What happened to your glasses? Huh? And no time to go get them fixed. Oh my gosh, I hope you're not seeing double.